welcome and hand over the mic, if you will, to Christina Bisanz, who is our CEO. Over to you, Christina. We can't hear you, Christina.
There we go. Thank you very much, Mary, and thank you all for joining us this evening for our very novel annual general meeting format. When we started planning this meeting last year, we were actually anticipating a very different kind of event that would be much more celebratory, as this year actually marks our 40th anniversary as an organization serving older adults in York Region and South Simcoe. We'd booked a wonderful venue, the caterers, guest speakers, full on all the ingredients for a CHATS in-person gathering. We could never have anticipated the circumstances under which we come together tonight. But preparing for the unanticipated by ensuring a strong, strategically planned foundation for the art organization is a key role of our board of directors. 4 years ago, the board's strategic plan set the direction for CHATS through the establishment of 5 pillars of priority. The first was accelerating options that support older adults to age safely and independently in their community by anticipating and adapting to address the changing needs of our population. Second, boosting our team's capacity by careful planning and implementing strategies to attract and retain the right people with the right abilities. Third, seeking and nurturing strong partnerships by initiating and building collaborations to strengthen care for clients and caregivers so they can live independently and safely at home. Fourth, driving operational and service excellence by pursuing opportunities to improve quality, efficiency, and sustainability. And lastly, advancing integrated service delivery by courageously advocating for system transformation and building a better model for home and community service delivery. Very lofty, but very strong priorities and directions. These pillars have steered and guided us well over the last few years, even though specific initiatives have been tweaked or amended based on various external and environmental factors. Our focus on advocating for health system change, for example, saw us undertake a significant role in the new provincial government's desire to change hallway healthcare by restructuring the health system, creating an overarching Ontario Health Organization supported by Ontario health teams throughout the province. This past year, CHATS played a leadership role in working on developing proposals and implementation plans for all 4 of the Ontario health teams situated across the vast geography that we serve. Currently, 2 have been approved, 1 is imminent, and the 4th is in development. We've also been invited to participate in a 5th OHT. We have advocated and positioned ourselves well for transformation. Boosting our team's capacity by careful planning and implementing strategies to attract and retain the right people with the right abilities led us to restructure our assisted living staffing model in several of our assisted living sites. This has been a tremendous undertaking that has proven itself through increased staff satisfaction and decreased the need for us to contract outside agency support. At a time when retaining scarce personal support worker support has been crucial, our focus in this area has proven invaluable. By pursuing opportunities to improve quality, efficiency, and sustainability, we also implemented a mobile communication system that's helped our frontline staff stay connected and informed while providing direct care to their clients on the front lines. We've been in a state of pandemic emergency for 104 days now. Never before has a situation outside of our control required us to accelerate ways to support our clients to be able to weather through this state of emergency. We tackled the crisis head on, using our toolbox of creativity, nimbleness, flexibility, and quality with full regard for the safety and well-being of our clients, volunteers, and staff. From day one, we anticipated and adapted to the needs of the persons we serve under unprecedented conditions. We maintained essential services for those clients most at risk and reimagined other programs which were prevented by the need for physical distancing and isolation, such as our Adult Day wellness and diversity programs, into virtual service offerings that maintained the social engagement and connectivity that is so crucial to our clients and caregivers. This past year also saw us proving the value of integrating home and community care for successful and supportive transitions of seniors from hospital to home through our involvement as a partner in the innovative South Lake at Home and Mackenzie Helps initiatives. With Mackenzie Helps, we also ensure the integration of focused caregiver support as part of the care coordination so that they were able to cope and manage keeping their loved ones safely home once they came back from hospital. While working with our community partners has always been part of our DNA as an organization, our ability to serve the community has never been more evident and acknowledged than in this time of COVID. For example, the pandemic demonstrated the importance of ensuring food security and access for vulnerable persons in our community. By working with support from the United Way and the Ontario Community Support Association, we partnered with local food pantries, the York Region Food Network, Care First, Human Endeavour, the Canadian Mental Health Association in York Region, and Addiction Services York Region, to name a few, in order to distribute 390 culturally specific food hampers and essential household items, which were the equivalent of 1,950 meals. We distributed 1,370 culturally specific hot meals. The total meal equivalent delivered was over 4,000. We were able to give 68 people referrals to programs for telephone reassurance, grocery shopping, transportation, Meals on Wheels, Lunch Out, Healthy Aging, and the list goes on. These are just some of the highlights of CHATS accomplishments over the past year. The annual report, which many of you will have received with your AGM invitations, provides more details on some of them. While circumstances have prevented us from having the anniversary celebration that we've been hoping for, as an organization, as a team, as a partner in the healthcare system, we do have much to celebrate. I sincerely thank our board of directors and the committee members who supported for their wisdom and guidance in giving us such strong pillars and strategic direction to be successful. I also want to acknowledge the many volunteers who give their time and themselves because they believe in our mission and vision. My deep appreciation and gratitude to the most amazing staff team, from the front lines of personal support workers, home support workers, drivers, service coordinators, recreation programmers, supervisors, through to administrative staff in communications and marketing and fundraising, human resources and finance, that give what it takes to our clients and caregivers with quality and compassion. And a special thanks to the leadership team and my team of senior directors, Rhonda Flanagan, Jeff Hogan, Nancy Hukula, and Janet Williams, who step up to any and all of the challenges as opportunities to be solved, because that is what truly defines us. And last but not least, I want to acknowledge my personal thanks to our board chair, Ian Hilly, who for the past 2 years have provided me with advice, encouragement, and gentle persuasion to always reach for more and strive for better. Thank you very much.